This medication is used to treat or prevent certain types of headaches, such as migraine headaches and cluster headaches. Ergotamine helps narrow widened blood vessels in the head, which reduces the throbbing effects of vascular headaches. Caffeine also helps by narrowing the widened blood vessels in the head. This suppository form is used when medications cannot be taken by mouth, for example, due to nausea and vomiting. It is important to follow the recommended daily dosage and take it at the optimal timing for the best results. When using Ergotamine-Caffeine Suppository, unwrap and insert one suppository rectally as directed by your doctor. Stay lying down for a few minutes and try to avoid having a bowel movement for an hour or longer so the drug can be absorbed properly. The suppository is specifically for rectal use only. If the suppository becomes too soft due to heat exposure, you can chill it in ice-cold water before unwrapping and using it. The dosage of Ergotamine-Caffeine Suppository is based on your medical condition and how you respond to the treatment. This medication works best if used as soon as the first signs of a headache occur. Waiting until the headache worsens may result in the medication not working as effectively. It is important to note that this medication should only be used as needed and is not meant for long-term daily use. The maximum dose is 2 suppositories for a single headache attack and 5 suppositories in any 7-day period. If you suddenly stop using this medication, you may experience withdrawal symptoms such as rebound headaches. To prevent withdrawal, your doctor may gradually lower your dose. Withdrawal is more likely if you have used this medication for a long time or in high doses. Inform your doctor or pharmacist if you experience withdrawal symptoms. Additionally, if you find yourself using drugs for migraine attacks on 10 or more days each month, the drugs may actually make your headaches worse. Do not use medications more often or for longer than directed. Notify your doctor if you need to use this medication more often, or if the medication is not working as well, or if your headaches worsen. Some common side effects of Ergotamine-Caffeine Suppository may include nausea, vomiting, restlessness, trouble sleeping, and dizziness. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any of the following serious side effects: rectal pain or bleeding, irregular heartbeat, tingling or coldness in the fingers or toes, loss of feeling in the fingers or toes, bluish hands or feet, muscle pain or weakness, severe stomach or abdominal pain, lower back pain, or signs of kidney problems such as changes in urine output. In rare cases, a very serious allergic reaction to this drug may occur. Seek medical help right away if you notice symptoms of a serious allergic reaction, such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed here. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you're in Canada, you can report side effects to Health Canada at 1-866-234-2345. It's important to be aware that taking this medication with certain other drugs can increase the risk of serious side effects, such as a lack of blood flow to the hands and feet or to the brain, which could cause a stroke. These drugs include azole antifungals, cobicistat, mifepristone, certain antidepressants, macrolide antibiotics, HIV protease inhibitors, and SSRIs. It's best to consult with your healthcare provider before taking this medication with any other drugs. Remember to always follow the dosage instructions provided by your doctor and take the suppository at the optimal time for the best results. Before using this medication, it's important to inform your doctor or pharmacist about any allergies you may have to ergotamine, caffeine, or other related drugs. Also, it's important to inform them about your medical history, especially if you have conditions such as high blood pressure, heart disease, liver or kidney disease, or if you are a smoker. This medication can make you feel dizzy, and using alcohol or marijuana can make this effect worse. It's important to avoid driving or operating machinery until you know how this medication affects you. Limiting alcohol consumption is also recommended, and if you use marijuana, it's important to discuss this with your doctor. Using tobacco products while taking this medication can increase the risk of serious side effects, so it's important to talk to your doctor about how to stop smoking if you are a smoker. Before undergoing any surgical or medical procedures, it's important to inform your doctor or dentist about your use of this medication, as it may have interactions with other drugs or products. It's important to avoid using this medication during pregnancy, as it may harm the unborn baby. Reliable forms of birth control should be discussed with your doctor, and if you become pregnant, it's important to inform your doctor immediately. This medication can pass into breast milk and may have negative effects on a nursing infant, so breastfeeding is not recommended while using this drug. Consulting your doctor before breastfeeding is important. When taking ergotamine-caffeine suppositories, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. If you also take triptan migraine drugs, such as sumatriptan or rizatriptan, it's important to separate your triptan dose from your dose of ergotamine-caffeine suppository to reduce the risk of serious side effects. Ask your doctor how long you should wait between your doses of these drugs. Some products may contain caffeine or other ingredients that could raise your heart rate or blood pressure. This includes certain beverages like coffee, colas, and energy drinks. Make sure to inform your pharmacist about all the products you are using, and ask how to use them safely, especially cough and cold products, diet aids, or other headache products. It's also important to be aware that this medication may interfere with certain medical/lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you use this drug if you are undergoing medical/lab tests such as dipyridamole thallium imaging tests, urine catecholamine levels, or urine 5-HIAA levels. If this medication is swallowed, it could be harmful. In case of an overdose with serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. Symptoms of an overdose may include severe dizziness or drowsiness, loss of feeling in the fingers or toes, rapid or weak heartbeat, bluish hands or feet, and seizures. It is important to take this medication exactly as prescribed by your healthcare provider, and to not exceed the recommended dosage. If you have any concerns or questions about the appropriate use of this medication, be sure to consult with your healthcare provider. It is important to avoid sharing this medication with others. There are certain foods, beverages, and food additives, as well as lifestyle patterns, that may trigger a migraine headache. These include red wine, cheese, chocolate, monosodium glutamate, and alcohol, as well as irregular eating or sleeping habits and stress. Avoiding these triggers may help decrease the frequency of migraine headaches. It's best to consult with your doctor for more details on managing your migraines. When it comes to taking the ergotamine-caffeine suppository, it's important to follow your doctor's instructions regarding the correct dosage and timing. They will be able to provide you with the best advice on when to take the suppository for optimal effectiveness in managing your migraines. If you happen to forget a dose, just take it as soon as you remember. But if it's almost time for your next dose, then just skip the missed one and continue with your regular schedule. Do not take a double dose to make up for the missed one. It's best to stick to the recommended dosage and timing for this medication to be effective. Be sure to store the ergotamine-caffeine suppository in the refrigerator, but do not freeze it. Keep it out of reach of children and pets. When it expires or is no longer needed, be sure to properly dispose of it. You can consult with your pharmacist or local waste disposal company for guidance on the proper way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.